Have you recently received news about a positive tuberculosis screening test, leaving you wondering what happens next? It is completely natural to feel a mix of concern and curiosity, especially when presented with unexpected health information. When a tuberculosis screening test, such as a skin test or a blood test, comes back positive, it does not immediately mean you have active tuberculosis disease. Instead, it signifies that you have been exposed to the tuberculosis bacteria at some point, and your body has developed an immune response. This positive result means your healthcare provider will recommend further diagnostic tests to determine if you have latent tuberculosis infection or active tuberculosis disease. The reason for these follow-up tests is that initial screening methods are designed to be highly sensitive, meaning they are very good at detecting exposure but cannot differentiate between a past infection that is now dormant, known as latent tuberculosis, and an active infection that could make you sick and spread to others. Latent tuberculosis means the bacteria are present in your body but are inactive, causing no symptoms and not contagious. Active tuberculosis means the bacteria are multiplying and causing symptoms, making you infectious. Confirming the type of infection is vital because the treatment approaches are distinctly different. Your doctor will typically begin with a thorough medical evaluation, including asking about any symptoms like a persistent cough, fever, night sweats, or unexplained weight loss, as well as your medical history and any potential tuberculosis exposure. The next steps usually involve a chest X-ray to look for changes in your lungs that suggest active tuberculosis disease. You might also undergo sputum tests, where samples of mucus from your lungs are collected over several days to be examined under a microscope for acid-fast bacilli, and sent for culture to grow and identify the tuberculosis bacteria. In some cases, a second blood test called an interferon gamma releases assay, or IGRA, might be used to confirm initial screening results, particularly if a skin test was positive. These follow-up tests are critical for an accurate diagnosis, which then guides the most effective treatment plan. If active tuberculosis disease is confirmed, contact tracing might be initiated to identify anyone who may have been exposed, an important public health measure. Furthermore, even if you have latent tuberculosis infection, treatment is often recommended to prevent it from progressing to active disease later in life. Staying on top of these additional tests and treatments is a powerful step in safeguarding your health and the health of your community. Ultimately, completing these additional tests after a positive tuberculosis screening provides a clear path forward. It transforms uncertainty into a precise diagnosis, allowing your healthcare team to prescribe the exact treatment you need. This process ensures you receive appropriate care for either latent infection or active disease, effectively managing your health and preventing further transmission.